we all have kind of a myopic perspective on viruses and infections, and we think that we're well acquainted with them, but we tend to forget. And I think COVID has been a great example of our forgetting the pain and suffering that can be afflicted by a pandemic virus. And in my scientific lifespan of about 50 years, we've seen about a dozen viruses that have emerged that have infected the brain. So there is the potential of causing very severe disease of the nervous system. The only thing that really protects us is our immune system, and we've evolved along with those viruses, and our immune system has been capable of suppressing viral infections in the central nervous system. But as I mentioned right at the beginning, we are becoming an older and older population. By 2035, about 20% of the US population will be over the age of 60. And individuals, as they get older, also develop a senescent immune system, just like a senescent brain. And that makes them susceptible to some of these viral infections, some of which can grow quite dramatically in the brain. A best example is influenza. Influenza, as we normally appreciate it as a seasonal flu, does not infect the brain, but in the avian form, individuals who have contact with waterfowl or even land-based poultry who can get a high enough dose can actually get what's called avian influenza. And that flu does infect the brain and causes severe destruction of the brain. What spares us from getting that is avian flu does not transmit well from human to human. So we're protected by that, but it's not a great protection. That whole capacity to spread from human to human just requires a mutation in 4 amino acids in the envelope of the of influenza that could then lead to a significant neurologic infection. So the good news is that our immune systems are protecting us from these emergent viruses. Bad news is that there's a lot of them, and COVID is a great example, having emerged within the last 2 years and quickly made that unfortunate leap from species to species, which is a big energetic barrier for a virus to make. But once it's made that, it can grow quite well, as we've seen how COVID's done. But we had a previous plague, and that was HIV, and it actually was on track to become a significant cause of dementia. About a quarter of individuals who were infected with HIV in the terminal stages of the disease developed dementia, just like the syphilis dementia. And in this case, HIV, like syphilis, exhausted the immune system and led to a significant central nervous system infection of the microglial components of the brain that secondarily led to degeneration of the brain. So I think Mother Nature is continuing to show us many, many examples of what she can do. She's got a big basket of interesting tricks, and affecting the human brain is certainly one of them.